Hi, let's talk about urinary autonomics. In this video, we'll discuss the basics of the autonomics serving the kidneys, ureters, and urinary bladder. I should probably preface this by saying that understanding the foundational anatomy of the autonomic nervous system can be challenging for most students. Even individuals that have had anatomy before sometimes struggle with how to relate the various aspects of sympathetic and parasympathetic fibers serving various plexuses. So if you don't get it the first time, sit down with a pad and paper or a tablet and a digitizer and write it out for yourself. I think that would be a big help for you. Now, in understanding how renal function is controlled, we should first tip our hats to the fact that most of the regulation of renal processes is intrinsic, but there is some extrinsic control, even hormones not produced by the kidneys. So for instance, antidiuretic hormone or natriuretic hormone are going to have an influence on what happens at the level of the nephron. But there is also going to be extrinsic neural control by means of the renal plexus, which is a mixed autonomic plexus that can be found in association with the renal vasculature. So these fibers and ganglia are going to be located about the renal arteries and their branches as they multifurcate throughout the parenchyma of the kidney to serve the nephrons. Now, with any mixed autonomic plexus, there's going to be two separate responses, the sympathetic and the parasympathetic. And much like the sympathetic fibers are going to dominate the renal plexus, the sympathetic responses will as well. And so with a sympathetic response, we will see vasoconstriction, which is very typical of a sympathetic response. And we'll also see the stimulation of the juxtaglomerular apparatus, meaning a secretion of renin and the beginning of the RAA pathway. In terms of the parasympathetic response, we'll see vasodilation, which is more just a return to baseline tone of the vasculature. Now, here are a lot of words and a lot of visuals thrown at you. I've color-coded them for our convenience. So, for instance, anything that is showing up as orange is going to be purely a sympathetic input. Anything which is this light color of blue is a parasympathetic input, and anything that is showing up as green is going to be a mixed autonomic plexus or ganglion. So let's start with the sympathetic side of things and work our way through. So as you'll recall, sympathetics are arising from the ganglia of the sympathetic chains. And we can see the sympathetic chains descending down into the abdominal cavity. There's a left and a right, and the ganglia that participate in these chains are known as paravertebral ganglia because they are to the sides of the body of the vertebrae. Also descending down from the thorax are, on either side, three thoracic splanchnic nerves. So you'll remember these as the greater, the lesser, and the least thoracic splanchnic nerve, all coming from various thoracic sympathetic ganglia descending down, piercing typically through the crura of the diaphragm to eventually synapse in what are known as pre-aortic ganglia, which we'll get to. That's what these green things are here that I'm putting X's through. So you'll notice that there are also, as we descend down in the chain, going to be lumbar ganglia. So this would be probably a T12. This would be an L1, an L2, and an L3, and so on and so forth. And these lumbar ganglia can also have splanchnic nerves, so fibers that are moving out from the ganglia to serve viscera, typically by means of perivascular plexuses, as we'll see. And we can see here, there are L1 and L2 splanchnic nerves in play. So that's the sympathetic side. The parasympathetic side, there are going to be anterior and posterior vagal trunks, if you recall. So these get their names from their relationship to the esophagus. The anterior vagal trunk is anterior on the esophagus. The posterior vagal trunk is posterior on the esophagus. They're the lion's share of the innervation of the esophageal plexus, and they're following the esophagus down through the esophageal hiatus of the diaphragm. And that anterior vagal trunk really isn't a significant player in the abdominal autonomics. It serves some function to the stomach and to the biliary tree as well as the liver, but beyond that, most of the autonomics of the pelvis and what we're seeing today are going to be complements of that posterior vagal trunk. So the posterior vagal trunk is predominantly going to be the fibers from the right vagus nerve as well as some fibers from the left vagus nerve. And as it descends down through that esophageal hiatus, and it ramifies, its fibers are going through various pre-aortic ganglia, but they're not synapsing there. They're just moving through the ganglia. It's only sympathetic fibers or preganglionic sympathetic fibers which are going to synapse in those ganglia. And then postganglionic fibers will meet with those preganglionic parasympathetic fibers of the posterior vagal trunk to form these mixed autonomic plexuses, which we see in green here. We also might notice that these are in association with the arteries here. And so we can see as we come down branches of the abdominal aorta. So for instance, this is the celiac trunk, and then we have the superior mesenteric artery, and then we have the renal arteries on either side of that. Then coming down here, we have the inferior mesenteric artery, and we have a gonadal artery heading out that way. And what you might notice is that these mixed autonomic plexuses form perivascular plexuses in association with these vessels, and they're going to use them as a means to travel out to target organs. And so let's see what we have in the way of ganglia here. So flanking the celiac trunk, we have celiac ganglia, and the fibers which connect them and surround that trunk are the celiac ganglia and plexus. I'll just put G and P there. There's also a superior mesenteric ganglion and plexus, and it receives all of its fibers from the celiac ganglia and plexus. Those are very closely associated with one another. But flanking that superior mesenteric artery, we're going to have the aortico-renal ganglia. And then upon the renal arteries, I'll just circle them really large, we have the renal plexuses. So the renal plexuses are going to follow the renal artery and its branches out through the parenchyma of the kidney to really serve the nephrons and associated tissues. Below the superior mesenteric artery, and above the inferior mesenteric artery, which is here, we have a region known as the intermesenteric plexus. That intermesenteric plexus is also known as the aortic plexus, but the aortic plexus is typically much larger. It continues on down to the bifurcation of the aorta, and most people will use these two plexuses interchangeably. Also, just below the bifurcation of the aorta, so these are the common iliac arteries, we have the superior hypogastric plexus, which is a mixed autonomic plexus, and then collections of fibers that are traveling down to communicate with the inferior hypogastric plexuses, which are known as the hypogastric nerves. So this is just giving you the lay of the land for the parasympathetics and the sympathetics and the mixed autonomic plexuses and their ganglia as we move through. But let's focus now on the inputs to the renal plexus. Again, mixed plexus, it's showing up as green. There are small ganglia associated with these plexuses, and they're typically found just posterior to the origins of the renal arteries. So you can find them just beyond those arteries. We can't see them in this illustration. The plexus is mixed, but it's predominantly, both in terms of its fibers and its actions, a sympathetic leaning plexus. So, and when activated, it will cause vasoconstriction, so it will limit the flow of blood through the kidney, as well as the secretion of renin by the activation of the juxtaglomerular apparatus. In terms of inputs from various sources, the celiac ganglia and plexus are going to provide fibers down to the renal plexus. Also, the aortico-renal ganglia on either side will provide inputs to the plexus as well. The least thoracic splanchnic nerve, when it's present, this is coming down from T12 there, is going to provide a direct input to the renal plexus, as is the splanchnic nerve from the first lumbar ganglion. So that would be the first lumbar splanchnic nerve. There's also going to be some input ascending from the intermesenteric or aortic plexus. So some of this is coming up from the inferior to the renal plexus. So this gives you the lay of the land here, serving the kidneys. But we should also note that the ureters are going to pull fibers from the renal plexus there. They'll also pull fibers from the intermesenteric plexus. They'll also pull fibers from the gonadal plexus on the gonadal arteries, and even the inferior mesenteric plexus as well. These ureters, not really showing this well in the diagram here or the illustration, are going to cross into the pelvis at the bifurcation of the common iliac artery. So there's going to be an external iliac and an internal iliac. That internal iliac is also known as the hypogastric artery. So the superior hypogastric plexus is above that, and the inferior hypogastric plexus is below that. And these hypogastric nerves, quote unquote, help to communicate that. And we're going to see that the paravascular plexuses following this vasculature is also going to serve the abdominal and pelvic parts of the ureters as well. And that leads us to the pelvis, and we touched on this in the previous video, but let's kind of give ourselves the lay of the land here. So this is the ventral primary ramus of S1, and of S2, and of S3, and of S4. I can also see, let's use the correct color blue. Coming off of these ventral primary rami, I see a branch here, and a branch there, and a branch there, and a branch there. So these are coming from S2, S3, and S4, and these are the pelvic splanchnic nerves. So these are parasympathetic fibers from ventral primary rami of sacral nerves S2, 3, and 4. Keep in mind that these VPRs are also conducting a tremendous amount of somatic, motor, and sensory fibers as well. The entirety of that ventral primary ramus is not going to be dedicated to the autonomics, but people think that because the sacral outflow of the parasympathetics comes from S2, 3, 4, that those nerves are entirely parasympathetic, and that couldn't be farther from the truth. So if you see branches coming from these ventral primary rami, look to see where they're going, and if they're going out to a plexus of nerves, those are most likely going to be pelvic splanchnic. So pelvic splanchnic nerves are parasympathetics, S2, 3, 4. The sympathetics are going to come from the sympathetic trunk. And we can see the trunk heading this way, and it will go down to the ganglion impar of the coccyx there. I can see S1 and S2. I can see, looks like a little bit of S3 there. And I get a very strong fiber from S2. I even see a fiber from S3 there. Generally, the preponderance of fibers going into this inferior hypogastric plexus are coming from S1 and S2, but this might have just been a dissection issue. These fibers are very, 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 very delicate. So just to give you kind of the lay of the autonomic land here. So this meshwork is the inferior hypogastric plexus. The superior hypogastric plexus would be up here. Hypogastric nerves would communicate between the two. This would be a two-way path. So for autonomics to ascend and descend in and out of the pelvis. And this inferior hypogastric plexus is going to communicate with plexuses that serve abdominal organs. And so let me go back to red here and point out some of these to us. So here is the urinary bladder. Here is the uterus and the vagina. And then here is the rectum. With respect to the plexuses that serve these groups, we'll have a vesical plexus coming out and surrounding the urinary bladder. There's also going to be a uterovaginal plexus and a middle rectal plexus. And all of these plexuses are in communication with this inferior hypogastric plexus. Sometimes some sources will say that, the vesical plexus is the anterior-most aspect of the inferior hypogastric plexus. This isn't technically incorrect, but a lot of sources will separate out the vesical, uterovaginal, or prostatic if there's a prostate present, and middle rectal plexuses from the inferior hypogastric plexus. However you want to conceptualize it is fine. Some other objects to point out to you so that you can perhaps get a better understanding of what you're seeing. So this is a sagittally sectioned pelvis. There's your pubic symphysis. Here is the sacrum coming down, and the coccyx associated with that, and then the fifth lumbar vertebra on top of that. And so you're looking at a left pelvis here. So we've discussed the autonomics of the kidney, so the renal autonomics, as well as the lay of the land of the abdominal autonomics. We'll get into much more granular detail when we are in the GI sessions, but it's good to have some foundation and some reinforced repetition as we go through, because anatomically these are challenging areas. We've also discussed the autonomic innervation of the ureters as well as the urinary bladder, and the communications between the inferior hypogastric plexuses and the superior hypogastric plexus and the various autonomic plexuses of the pelvis, the vesical, the uterovaginal or prostatic, and the middle rectal plexus. This is your summary slide. Thank you for your time.